Hi, I'm Dr. Timothy Matthews. I'm an ENT surgeon or ear, nose and throat surgeon, otologist and neurotologist. That means I'm a surgeon specialised in all disorders that affect the ear, including hearing implants and cochlear implants to treat hearing loss. What is hearing loss? Well, usually self-evident, but it can be confirmed with a formal hearing test with an audiologist. And many patients come to see me with an identified hearing loss on hearing testing. In terms of symptoms that this gives a person, often they find that they are struggling to communicate in many aspects of their life, affecting their ability to interact with colleagues, family and friends. It's often brought to their attention by friends and family as a source of both embarrassment, isolation or frustration. There are really two main types of hearing loss. The first is what we call a conductive hearing loss, which is an issue with sound getting to the inner ear. The second type of hearing loss is called a sensory neural or inner ear hearing loss, where the inner ear can't convert sound signals to nerve signals to travel to the brain. There is also the potential to have a mixed hearing loss, which is a combination of the two. My expertise in all aspects of ear surgery allow me to both look at the type of hearing loss, whether it's conductive or sensory neural, and the potential causes for that type of hearing loss. Some causes of different types of hearing loss are reversible, such as simple issues with earwax that can be fixed in the clinic. But rarely someone may have an irreversible cause for their hearing loss and also be unable to wear a traditional hearing aid. There may be many reasons that a person is unable to wear a traditional hearing aid, including prior surgery, conditions present since birth, or recurrent infections. What options are there other than a traditional hearing aid? Well, in these circumstances, I assess a patient's whole personal situation. That includes their type of hearing loss and the reasons that they can't wear a traditional hearing aid. I may, depending on a patient's particular circumstance, recommend a bone-anchored hearing aid or a device called an active middle ear implant. Both of these devices enable a patient to hear without having a traditional hearing aid have to fit or block inside the ear canal. Given the many available options, both surgically implanted and non-surgically implanted devices in this group, I can advise a patient on their particular circumstances and recommend either the best device for them or the options available to them in their particular situation. There are many different options in terms of surgically implanted devices. Some of these can be placed under local anaesthetic without any need to be put to sleep for patients who wish a minimally invasive surgery. Other devices are implanted entirely under the skin with a general anaesthetic, and the external component of the device is only worn when a patient wishes to hear. And when hearing is not required, such as when swimming or sleeping, this external component can be removed and recharged. So in summary, why do many of my patients choose to have a surgically implanted hearing device? Simply put, it's to improve their quality of life and reconnect with friends, family and colleagues. What is a tympanic membrane perforation? Well, simply put, this is a hole in the eardrum. It can cause various symptoms for patients, but commonly it causes an issue with hearing loss and recurrent ear infections, especially after water exposure. The precipitating event or initial thing that caused the hole in the eardrum is often known to patients and can be due to a simple infection after a cold or flu that ruptures the eardrum or bursts the eardrum. Trauma, such as a sharp blow to the head or the ear, like falling from a height onto water, or potentially can be after surgery on the ear. Even simple surgeries such as placement of a grommet tube as a child. Why does a hole in the eardrum cause these symptoms? Simply put, the eardrum has two functions: as a barrier or wall to prevent water from penetrating deeper inside the ear. The second function is its function as a vibrating mechanism. It's the first point when sound waves enter the ear that vibrates with those sound waves, converting it into a vibration that the inner ear can interpret as sound. I'm often asked by patients, do all holes in eardrums need to be fixed? And the short answer is no. An eardrum perforation may cause no symptoms if it is small and the ear is kept dry. Additionally, some patients may have other medical conditions that prevent them from having their eardrum perforation fixed surgically. Lastly, there is a high chance with some holes in the eardrum that they may repair spontaneously or by themselves. This may often occur if a hole has been caused by sudden trauma or a single infection. Many or up to 90% of these holes will heal by themselves over the course of 3 to 6 months. Holes that are less likely to heal are those where there has been either chronic infection or the hole has been present for a long period of time over the course of many months or years. So typically if a patient asks me when should they have their tympanic membrane repaired, I tell them that it's worth repairing it if it has been present for more than a few months, it's causing them hearing loss and or recurrent infections. How do we repair holes in eardrums? This is usually done under a general anaesthetic or being put completely to sleep. There are two main options available. One is via a cut behind the ear, and the other is a technique which I have advanced training in called endoscopic ear surgery. What is endoscopic ear surgery? Endoscopic ear surgery is using the natural conduit of the ear canal to look down and repair the hole in the eardrum. It is a minimally invasive surgery with no cuts visible on the outside of the ear. We use high-definition cameras and detailed instruments to patch the hole under the eardrum. What are the potential benefits of endoscopic ear surgery? The primary benefit is avoiding a cut behind the ear. A cut behind the ear can cause simple but troublesome issues with scarring, numbness of the outer ear, and a change in the position of the outer ear, either pushing it forwards or lower. Endoscopic ear surgery avoids the need for this cut and those potential complications of the cut. What can patients expect after surgery? Typically there's a 90% success rate in closing the hole of the eardrum. It does rely on the eardrum growing over the patch or scaffold that we put under the hole, so there will always be a small chance that the surgery is not successful. But in the vast majority of patients where surgery is successful, they can enjoy a waterproof ear that hears better and is free from infection. One of the diseases I see patients with is chronic suppurative otitis media. This means chronic middle ear infection and is often present when patients suffer from recurrent discharge, hearing loss and pain in the ear. Patients typically have a history of recurrent ear infections as a child and may have even had multiple ear surgeries as a child. Even simple surgeries such as placing a ventilating tube or grommet in the eardrum for build-up of fluid behind the eardrum. Uniquely, with chronic middle ear infections, they can occur even when there has not been significant water exposure, such as with swimming and placing the head underwater. Patients are often aware of a gradual deterioration in their hearing, and this can be confirmed with a hearing test prior to their review in my clinic. I can also arrange for hearing tests to be done on the day in our clinic. Rarely there are more severe forms of middle ear disease. One of those is called cholesteatoma. Cholesteatoma is a disease where the skin of the eardrum becomes trapped within the ear. Cholesteatoma is a difficult problem because it is an aggressive disease that can cause progressive damage to hearing and other structures around the ear, rarely affecting the ability of the face to move and hearing and balance permanently. Cholesteatoma can only be cured by surgery, and therefore it is important to identify. How is cholesteatoma diagnosed? It is usually diagnosed clinically, which means an ear, nose and throat surgeon such as myself looks at the ear under the microscope and identifies the skin trapping within the middle ear space. We often will order additional tests both to confirm the diagnosis and assess the extent of the cholesteatoma spread. These tests include a CT scan of the ear and a hearing test if it has not already been completed by the time you see me in the clinic. Often surgery with this condition primarily focuses on curing the disease without improving hearing or potentially making the ear waterproof. Thankfully, my expertise in treating this condition allows me to both cure the disease and maximise the chance that we can enable a waterproof ear and minimise any hearing loss due to the condition. Many of my patients are able to return to swimming after their surgery and also either hear normally or utilise a traditional hearing aid. What are my particular expertise in treating these conditions? There are 3 techniques which I'm uniquely capable of offering patients. One is endoscopic ear surgery, which is a minimally invasive or keyhole technique. The second 2 are to do with reconstruction of the ear canal, which is often eaten away in this disease process, and the mastoid bone behind the ear, which is eaten away with these process. Reconstruction of both the mastoid bone and the ear canal allows patients to achieve a waterproof, normal looking ear on the inside. Rarely patients who are too unwell to undergo surgery require repeat ear cleaning and medical treatments to try and prevent the disease from rapidly progressing. Though thankfully this is a typically slow growing disease, cholesteatoma, as we mentioned previously, can cause significant issues. Many of our patients are often grateful to have a safe ear that is both dry and waterproof. The ability to be able to wear a traditional hearing aid or even hear well enough to not require a hearing aid is an added bonus. So in summary, chronic otitis media or chronic middle ear infection can be associated with a more serious disease called cholesteatoma. Cholesteatoma is a disease that needs to be treated surgically to improve the hearing, but primarily make the ear safe and waterproof.